What can you do to rejuvenate your face without going under the knife? Well, I want to show you a few different options out there that will give you a more youthful look with fillers and injectables. Today on The Younger You.
I'm on top of the world, now I'm living. And the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking all about injectables and the non-surgical ways you can bring youth back to your face. Let me introduce you to Dr. Thompson, one of my favourites, our facial plastic surgeon. Welcome back, Dr. Thompson. How are you?
Great.
All right, let's clear this all up to begin with. Injectables. Are they the same as fillers and Botox? A lot of women and men get it wrong.
Yeah, I answer that question all the time. Injectables are simply anything that's injected into the face.
That breaks
Botox,
the skin.
Yeah,
Gotcha.
Botox is included, fillers are included.
Let's get this cleared up from the very beginning. When we talk about injectable, are they the same as dermal fillers, Botox, and how does it differ when you decide where to use them?
Yes, injectables is a broad term that's applied to anything that is injected through the skin into the face. And Botox is included in that. Fillers are included into that. And in general, they're used to soften lines and wrinkles in the face.
Okay, what makes someone the perfect candidate? Now let's start off with fillers, because injectables is across the board. So fillers, what are you looking for when you look at doing a filler?
The perfect candidate for a filler is generally someone who has deep lines or folds, generally around the mouth. That's one of the places we use fillers a lot. Or they're just really hollow, or they need volume to their face. Another area that has recently become a lot bigger is injecting into the cheeks with Voluma, which we've talked about on the show before.
Okay, now that's regarding the injectable / dermal filler.
Fillers, correct.
Okay. Dermal filler, is it across the board? Is that a separate product?
No, it's not a separate product.
Okay.
And they've always been called dermal fillers, but now we just usually use the term filler because we inject the fillers. The dermis is just a layer of the skin.
Got you.
So there are lots of different places we inject fillers, so probably the more broad term filler is more appropriate.
Okay, it's probably a sweeping statement that I'm going to ask you, but this is something that I believe in. I've always thought having Botox is a great preventative if started earlier on, before fillers.
You're absolutely right about that, and fillers even can apply to that, but anything, anytime you're starting to see a line or a wrinkle, it's much easier to correct and prevent than when someone comes in and they're, say in their 60s or 70s and the lines are very deep. It's a little harder to correct
And
those.
that's where you're looking at using the fillers then?
Fillers or Botox, they both apply to that. It's easier when you start earlier with both of those.
People say you can go and have an injectable or some Botox in your lunch break. We're going to be faster and faster in our life. Is this something that you think is a good idea?
I do, and it's absolutely
lunch
true.
break stuff.
One of the things, a lot of things are advertised as immediate recovery or lunchtime facelift or whatever. Those are sometimes over promised or over exaggerated, but injectables really are come during your lunch break, come during, at the end of the day and go back to work the next day, no big deal.
But what about back to work after the injectables?
Yes, you do have the chance of a bruise. So as long as you're willing to accept that risk that you might get a small bruise, then absolutely, come during your lunch break.
So you're really saying there really, truly isn't any downtime?
There is no downtime, there really is. And I do tell people to avoid strenuous exercise for a few hours, but other than that, you can put makeup on within a half hour.
Okay.
You can cover, if you do get a bruise, you can usually cover it very easily.
A lot of doctors, when we come in and have a conversation as a patient, they recommend different types of fillers. Why do they do that? And do they all last the same amount of time?
No, they don't. They last different amounts of time. There are different fillers that are indicated for different areas. For example, if I'm injecting the lips, I choose a different filler than if I'm injecting the cheeks or the mid-face.
So a different brand of product?
Sometimes different brands, sometimes a different filler within the same brand. It just depends on what we're trying to accomplish.
Do you feel the patients are getting younger and younger coming into your office and we're more concerned because of society's pressures?
I've been seeing articles about the increase frequency of selfies has translated to increased procedures and increased plastic surgery. And I do think that we're kind of becoming more self-aware and, you know, seeing people post pictures of themselves online, and all of a sudden you see a wrinkle or you see a line and you want to do something about it.
How do you feel about that as a professional?
I love what I do, and I want people to feel better about themselves, but at the same time I sometimes tell people when they come in that, you know, I think this little, you know, minor blemish that you're pointing out
is
maybe
exactly that
isn't, yeah,
minor.
isn't maybe something we need to make a big deal out of.
I shouldn't talk. I'm always saying to you, what about this?
Yeah,
or that,
and it's
or
okay. And you know, that's my job, is to help, but it's also my job to make sure that people are thinking in a reasonable way and not obsessing about something that shouldn't be obsessed about.
After the break, we'll be back in the studio with Dr. Thompson to learn more about injectables, and then we're going to head over to meet our first patient.
Using a bronzer to contour your face and take 5 pounds off. Step 1. Apply foundation and powder first. Step 2. Using a matte bronzer, start at the top of the forehead and blend down to the temples. Step 3. Starting at the ear, draw a line under the cheekbone and blend. Step 4. Starting at the base of your ear, trace a line just under the jawbone and blend downwards. Step 5. Blend everything together carefully, making sure there is not any heavy lines. Step 6. Apply to the other side using steps 1 through 5.
Let's find out what Dr. Thompson thinks about Botox, not Botox, and then watch as he gives David a liquid facelift.
Even though you're in business to make money as well, I love the fact that you're okay to say, you know what? This isn't going to work. I don't think it's the right thing.
Yeah, that, and also sometimes I feel like the physicians are not quick enough to tell someone that they don't need something. For example, I'll have a patient that I did filler on, you know, 4 months ago, and they loved it and they want more. And I feel like, you know, if we put any more filler in your lips, it's going to look a little
strange,
unnatural or disproportionate, and I need to tell them that rather than just say, sure, I'll just, you know, inject some more filler.
Well, and that is truly important, because I know back home in Australia, I had some filler done under my eyes, and I went back and went, yeah, I need a little bit more, and they just did it.
Right.
And you were one of the people that said, what's going on? Why have you got so much in there? And that makes you feel more confident with the doctor as well.
Yeah, it's just important that, you know, yes, it is my profession, but my profession is to take care of people, and so I need to be honest in what I recommend.
What are the trends when it comes to having injectables nowadays? What are we seeing more being done?
I think we're seeing more volumization of the face. We're seeing that with fat injections from a surgical standpoint, and that's also translating to the fillers, that we're seeing more volumization to the face.
Okay, more guys than girls you're seeing more and more of?
I'm seeing a lot more men in my office in general, not just with injectables, but yeah, I am seeing a lot more men.
Well, hence my next question. We always ask our viewers to write in now to give you some questions. And it's Dr. Thompson, do you agree that more men are getting Botox, which I thought quite funny, in order to stay competitive in this economy?
Yeah, I would say that I have a lot of men coming to me that are kind of in the upper middle age category that are seeing these things happen, and they're either feeling tired or looking tired but not feeling tired, and just asking me what I can do to help that.
What are you doing more of, Botox or fillers?
That's a tough question.
Because you're sort of doing them both at the same time.
Very commonly I'm doing them both together, but you know, maybe Botox, but they're similar. They're both very, you know, highly used.
Well, this is interesting. We're going to take a look at some patients and find out why they wanted to have a liquid facelift. Let's take a look.
My name's Dave. I am doing the liquid facelift.
So we met before and kind of just did an initial visit, and we talked about that you might benefit from having some volume right in this area of your face. You don't have bags under your eyes, but you are a little bit hollow under here, and I think if we added some volume under there, that it would just make your whole face look rested and a little bit more youthful. And maybe we'll put a little bit of filler in these two, because your nasolabial folds are a little bit deep.
So the reason that I was interested in doing this is because I'm a little bit over the hill. I turned 41 recently. I'm a single guy. I've been through a lot of stuff. I made a lot of sacrifices in my work and been through a lot of things, you know. And I think I'm still in reasonably good shape. I take pretty good care of myself, inwardly and outwardly. And I think this is just one more thing that I could do to take care of myself.
Okay, so the first thing we're going to do is put some filler just right in these nasolabial folds to see if we can soften those up a little bit.
I talked to a couple of my friends and told them about this, and a few of them are kind of excited for me. They want to know, like they're curious. They want to know what this is going to do. I don't think it's going to change my life, obviously, but they're curious to see the before and the after and how that works out. The idea of this as opposed to something more drastic. In fact, maybe doing something like this now would stave off having to do something more intensive later on.
Okay, so we can just see now this side, he still has the fold as he always does, but it's not nearly as deep as it is on that side, and it just kind of softens that a little bit.
I just think anything you can do for yourself that's going to make you feel better, when you're out, whether you're single or wherever you are, it doesn't matter if you're single, but wherever you are, if you've got more confidence or if you feel better, you're going to have more confidence.
This furrow forms, it gets pretty deep, and the Botox will temporarily paralyze this muscle.
Well, I think I just want to be my best self, really is what it boils down to at the end of the day, because I'm not really nitpicky about myself, but that doesn't bother me. You know, I guess I'm kind of a typical guy, but at the same time, like, it is important to me to look as good as I feel.
When we come back, I want to show you how you can have a non-surgical rhinoplasty using injectables. Closed captioning for The Younger You is brought to you by Mindful Medical. Like us on Facebook for updates on the show and how to join the Younger You conversation. Let's meet Laurie and hear her incredible story of why she wanted to get injectables.
My name is Laurie, and I am getting a liquid facelift.
Laurie was in a bad car accident, and she's had a lot of scar tissue in her face, and we've worked on a few things to try and get rid of some of the tattooing that she has in her face that she's covering with some makeup right now. But today we're going to do some cosmetic things to just try and, you know, make your face look a little bit more rejuvenated.
I was in a motorcycle wreck a year and a half ago, and so I've actually had a lot of procedures, a lot of surgeries, a lot of lasers, a tiny bit of Botox. Dr. Thompson has done a few surgeries under my eye.
I'd like to put some filler down here under your eyes, some filler in the nasolabial folds, and some filler in some of these areas right here.
I'm 54 and would like to look better than 54. And I'm not really wanting to go into the deep facelift, you know, the downtime, 2 months off work. I'd prefer to come in, get a quick fix, and they say it lasts, you know, a year or two, so.
This is a skin graft here, and then I met you maybe 5 months ago, 4 or 5 months ago, and this that looks like bruising is actually tattooing in the skin. So, you know, this is just asphalt particles or dirt particles that got trapped in the skin, and they've permanently tattooed her skin. My
family thinks it's fabulous. I come from a family of 6 girls. We're all about looking younger, not the fake younger, the healthy, good younger. I think when you get up in the morning and you look good and like what you see, it makes for a better day and you're happier, therefore everybody around you is happier.
When someone has had trauma to an area, that area will actually be more sensitive to pokes and pain than the non-traumatized area.
Well, you come in and you're done in about 2-3 hours. You might need to miss 1 day of work, or you can go to work with a few little bruises. The other facelifts, you know, it's painful, you're in the hospital, you're off work 4, 6, 8 weeks. I just think that you should get as much done when you're younger as you can that's easy like this.
We can just see it's softer here, there's not as much of a deep fold, and here we can see the line more. Okay, hold that right there. So for the lips, I like Juvederm Ultra, which is what we're using, and that's also really good for fine lines. And for the area under the eyes, I use Juvederm Ultra. And then Juvederm Ultra Plus is for the deep folds, the nasolabial folds in the marionette area. And then Voluma is for adding volume to the cheeks.
If you don't feel right, if you don't like what you see, if you don't look in the mirror and are happy, I think it affects you, everything about your demeanor, the way you treat people. I think if you look good, look healthy, you're happy all over.
Now that we've seen Laurie's procedure, let's find out how Dr. Thompson can do a non-surgical rhinoplasty on Chantel.
My name is Chantel, and I will be getting an injectable into my nose. It's like a non-surgical rhinoplasty.
Hi, Chantel.
Hi.
How are you today?
Good, thanks.
Good. So how was everything last time with your filler?
Good.
Good.
Great.
So you feel like it's kind of accomplished what you were hoping for, and I know you had, in general, really like your nose, but just a couple little things that you wanted to try and refine, and I think the filler's a great option for that.
I've always been okay with my nose from face on, but my profile, I've had a bit of a bump in the middle of my nose, and anytime I catch it in a mirror or in a picture or on video, it just doesn't look like my face. All I see is my nose. And I've done a little researching and found out that you can put a little bit of filler in your nose, and it just gives you more of a sleeker profile and evens out that bump a little bit.
So Chantel originally came to me about a year ago, and you know, every nose is different and every person is different, and you might look at her and say, oh, her nose should be this way or that way, and sometimes surgeons are guilty of doing that, and she really is happy with her nose and it fits her face very well, but really the only thing she wanted to try to improve was that there's just a little bit of contour irregularity in her profile.
I don't necessarily want to change the entire look of my face, and the bump on my nose is subtle enough that I think that with just a little bit of filler above and below the nose and not having to do surgery, that I could get the look that I want without having to do something more drastic.
Now it's just kind of a straight line right along her bridge, and so you can't see that bump anymore.
I like that I've done this procedure, and I will continue to do it for as long as I'm able to, because I'm really happy with the results. My profile now looks like the front of my face. It looks like what I have always wanted it to look like, instead of just seeing something that I wasn't really happy with. So it's given me a lot of confidence, and it's made me really happy.
After this short break, I'll be bringing David and Laurie into the studio to find out if they are happy with their results. Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyounger.you.tv and check it out. Love to hear your comments. Was a liquid facelift enough to make Laurie feel beautiful again? Do you think David has noticed a big difference when he looks in the mirror? Let's find out.
Before we find out if our patients are happy with their final results, this is one part of the show that I love the best. Let's take a look at their before and after shots. Tell me how you feel you look looking at that.
I think I look at least 10 years older.
Okay.
I'm not very happy at all, and
All right.
tired.
Tired versus unhappy, is that what you think?
I do.
Okay. David, what do you think when you see that picture of you? And did you ever think you'd be sitting on a lounge talking about having injectables?
I really did. I thought I was a pretty handsome man before, but...
oh, got you.
Yeah.
Okay.
But, no, it's been really impactful for me, because I didn't realize, for example, how deep some of those brow wrinkles were. And I've had friends that had suggested, like, maybe I had to do something about that.
Okay. Guy friends or female friends?
Female friends.
Okay. Yeah. Dr. Thompson, when you see these before shots, I think to myself, they look amazing now. because I've forgotten what the before shots looked like. When you hear what something like David's saying is, a couple of my girlfriends have said maybe I should look at doing this. Do you find it's more of the girlfriend's influence on the guys?
Sometimes it is, but I think just as often people are looking in the mirror and seeing things that they don't like. And the changes that they're describing are exactly what we try to achieve with injectables.
And that's one thing I love about Dr. Thompson. When we've talked about liquid facelifts before and injectables and Botox and fillers and all the things that people think about, he doesn't overdo it.
No, he does not overdo it. He's fabulous.
Yeah.
He can look at you and know exactly what you need and make you feel comfortable about your decisions.
Okay, I want you to both to answer this question for me. You've been a hairdresser for 150 years.
150 years.
Like I was.
Okay. Yeah, exactly.
Thanks to fillers, it works.
Exactly.
Anyway, do you feel that society puts more pressure on you as a woman or you as a man to look younger and healthier every day?
I think society puts a lot of pressure on us women to look younger every day.
Do you think it's more than men?
I think it used to be a lot more than men, but as times have changed, I think men are getting right up there with us.
Okay, for your type of work, Dave, you know, out there in sales, doing your thing, do you feel you have to be competitive against the young guns?
You know, I think it's important to represent yourself the best that you possibly can. And I spent a lot of time in the gym and taking care of my body, but in the process of the last several years, I mean, I'm 42, I just noticed that the time catches up. So, you know, I want to look as good as I feel. I was referred to Dr. Thompson, and I liked him.
He's a pretty good bloke.
He's
Very much so.
He has a good manner.
Yeah. Dr. Thompson, I asked you this year that I wanted to see a skincare system put with the injectables, with the team this year. You did that. Talk us through what you did for them and why you feel it's important.
Sure. I usually recommend skincare to every patient that comes into my office because I sort of liken it to brushing your teeth. You don't really see a result from day-to-day brushing of your teeth, but if you don't brush your teeth over time, you see a huge consequence or a huge price. And the same thing applies to skincare. If you take care of your skin, if you use antioxidants, if you use sunblock, if you use growth factors, things that will help the overall quality and texture of your skin, it will pay huge dividends over time.
How did you feel about having those skincare systems put into place for you? Would you be the normal gal? Well, being a hairdresser, I'd think you'd be a little bit more in tune with what's possible out there. But would you just grab something from the supermarket shelf as an example?
No. I'm actually pretty picky with what I put on my face, and I usually do a lot of study on what I'm going to use.
On skincare?
Exactly. And so when Dr. Thompson offered me the skincare regimen, I was excited about it.
Nice. Did you see results, Dave? Because you take me as the guy that wouldn't be moisturising. Am I right, Dr. T?
Yeah. Most men are, fall into that category.
All right.
Yeah. No, I read my labels for the things that I eat, and I read labels for things I put on my body. I really like what you gave me. It was nice.
Did you see a result?
I did.
Okay.
Yeah.
Well, Dr. T, I think you did a great job. I think they look amazing.
Thank you.
Thank you for your story, Laurie.
You
I appreciate
are so
it.
welcome.
You both did a great job on camera. Big hat off to both of you. We truly appreciate it. Whether you're 30 or 50, injectables can bring back some of the stolen youth you desire. Fine lines and wrinkles can be a thing of the past when it comes to your journey in finding the younger you. If you want to find out more information about Dr. Thompson or our show, visit our website at theyoungeryou.tv, and I'll see you next week.
Next week on The Younger You, we'll be showing you some ways to remove that bump on the nose and fix nasal problems with a procedure called rhinoplasty. The Younger You set provided by Madison McCord Interiors.